Hi, I'm Stacy Huber, and I'm the Associate Dean for Curriculum at West Virginia University School of Nursing. The Clinical Assistant Program, or the CA program, actually came about during COVID out of necessity. We had second semester sophomore students returning to campus who had never been in the clinical setting during their first semester of their sophomore year due to the COVID shutdown. So we now had a lot of students who were struggling in the clinical setting, even just knowing how to talk to a patient or give basic care to a patient. And now we're expecting them to do more advanced skills like give medications. And so at the same time, we had our leadership students who were getting ready to graduate who couldn't get clinical time because of isolation or their nurses were sick. So we had two groups of students who were really needing extra time in the clinical setting and really extra eyes in the clinical setting. Our faculty were really worried that they weren't giving our students what they needed just because there were so many needs in the clinical setting. So magically, we put our leadership students, our senior level students, in clinical to assist the clinical instructor when caring for patients or supervising students in the clinical setting. It was brilliant sort of what happened. Our sophomore level students who had been isolated and really didn't know anybody in their nursing program now had sort of this big brother, big sister in the clinical setting. Someone to talk to, somebody to empathize with, somebody to go to with questions. So after fall of 2020, we formalized the program, we wrote objectives, we put it through our committees, and now all of our leadership students have an opportunity to have a CA day in the clinical setting assisting the sophomore level clinical instructor. This really enhances the curriculum for both the sophomore level and the junior level in that we're giving really unique active learning opportunities for both level of students.
My name is Tanya Thompson, and I'm an Associate Professor of Clinical Education. Here at WVU, we teach in teams. There is a course coordinator and a clinical coordinator who lead each of the teams. The clinical coordinator is the primary person that would be responsible for educating the rest of the faculty about the clinical assistant program. As we work in teams, we like to take the students into the clinical in small groups. It's very important that we're all on the same page. So typically at our meeting that we have prior to the semester is when the clinical coordinator would orient and educate the faculty about the clinical assistant program. The sophomore students really love having a senior student come into the clinical setting with their group. Oftentimes they say how much it's helped them just to relate to someone else that has been through this situation. The fourth year students could easily connect with the sophomore level students because they had been in their shoes before. So they had a lot of compassion for these students, which allowed them to feel as if they were making a difference for the future of nursing.
My name is Amanda Kitzmiller, and I am a clinical education assistant professor. So our clinical faculty that are going to be taking students with their sophomore students are provided a PowerPoint presentation and a recorded lecture that goes along with that. And they're also provided a quick reference guide that has contact information for the leadership faculty and the program coordinators. They also get on that quick reference guide information about the tasks and skills that the students can help with and the things that they cannot help with. The fourth year students sign up on a Sign Up Genius. The CA program is an assignment in their leadership course, so they are all required to sign up for a day. I create the Sign Up Genius from lists of dates and times that are provided to me by the sophomore clinical coordinators, and that way then the students can sign up for a clinical instructor that they know if they would like, a unit that they know, and then the students are required to reach out to the instructor they're going to be going to clinical with and provide them their goals ahead of time, just letting them know that they're coming. And the clinical faculty also have access to the Sign Up Genius so they can see who's coming with them at the same time.
My name is Amber Zeese, and I am a clinical education assistant professor. We created objectives for the assignment to go along with the course objectives, and then kind of built it from that. But then we also took into account the needs of the sophomore class, what they are doing, what the clinical instructors do skills-wise in that level, and built up some questions We also gave them some history about nursing education and nursing educators, because they don't really get any of that in an undergraduate course. So it's kind of a unique assignment and unique program that we had come up with. A lot of students have now been exposed to the role of the nurse educator. So a lot of them had said that they had never thought about what it was like to teach clinical. A lot of them know that they do not want to stand up and lecture for hours at a time, but they really like helping in clinical. So a lot of students have said that they would be interested in going back to school for their master's in nursing education or getting a job as a nurse educator. So that's been really interesting to see, because they otherwise would have not have any experience with that. Other students have said that they realize they don't want to, but for the most part it's been very positive.